All right, let's set a scene. Think about your dog or cat. Maybe they get a tiny cut, or you trim a nail just a little too short, or maybe after, a standard dental cleaning. And you notice the bleeding.
Yeah.
It just seems to keep going.
Yeah, that can be really unsettling for an owner.
Or maybe you see things like random nosebleeds,
Hmm.
or finding blood in their urine or stool, which is obviously worrying. What's going on there?
It's definitely alarming. And sometimes, it's minor, but other times it's a real signal that the body's mechanism for stopping bleeding isn't working quite right.
A problem with the clotting system.
Exactly. A potential issue with how their blood clots.
And that whole clotting process, that's exactly what we're digging into today. We're doing a deep dive into von Willebrand disease, you might see it called VWD,
Yeah.
in dogs and cats.
Yep. We've gathered a whole lot of detailed veterinary info, research papers, really looked into the science behind it.
And our goal here is to unpack all that key information for you. We want you to understand what VWD is, how it actually impacts pets, how vets figure it out, the diagnosis part.
And how it's managed day to day or in emergencies. Basically, giving you the essential knowledge about what's actually the most common inherited bleeding issue in dogs.
Which is surprising, right? That it's so common but maybe not widely known by owners until there's a problem.
Exactly. It often flies under the radar.
Okay, so let's start at the beginning. What exactly is von Willebrand disease at its core?
So the sources, they define it as a primary hemostatic defect. Let's break that down a bit.
Okay.
Hemostasis, that's just the fancy word for the body stopping bleeding. And primary refers to the very first step in that process.
Okay.
Forming a platelet plug. You get a little leak in a blood vessel, and the first thing the body does is try to plug it up with platelets. So VWD means there's a problem with that initial plug formation.
So the first responders, the platelets, aren't doing their job effectively.
Precisely. Or they can't because they're missing a key helper. That helper is a specific protein called von Willebrand factor, or VWF.
Oh, okay.
With VWD, either the pet doesn't make enough of this VWF protein, or the protein they do make doesn't function the way it's supposed to. A quantity or quality issue.
Got it. VWF. And you said this is the most common inherited one in dogs.
It really is, yeah. The data shows it's #1 for inherited bleeding disorders in dogs. We see it much, much less often in cats, but it can happen.
So why is this VWF protein so critical? What exactly does it do?
Well, it's actually pretty neat. It has two main jobs in the whole clotting cascade.
Okay, job number one.
Job #1 is acting like biological Velcro or glue right at the site of the injury. When a small vessel gets damaged, VWF sticks to the vessel wall, and then it grabs onto platelets floating by.
So it anchors the platelets?
It anchors them, and then it also helps them stick to each other. It's essential for building that initial platelet plug, like the scaffolding.
Okay, so it's the bridge builder.
Right. And the sources point out something interesting here. It's the largest versions of the VWF protein, these big multimeric forms, that are best at this job, especially where blood is flowing quickly under what vets call high shear stress. You need the big sticky ones then.
Makes sense. Bigger tool for a tougher job.
Okay.
Okay, that's role 1, platelet glue. What's the second role?
The second role is protection. VWF acts as a carrier, like a bodyguard, for another clotting protein called factor VIII.
Factor VIII. Okay, different factor.
Yeah, factor VIII is crucial for the next stage of clotting, forming a stronger, more permanent fibrin clot. VWF basically chaperones factor VIII in the bloodstream, protecting it from being broken down too fast.
Right, so if you don't have enough working VWF,
then your platelets can't stick together properly, especially in those small vessels or where blood flow is fast.
leading to prolonged bleeding.
Exactly. And potentially your factor VIII levels might be a bit lower too because it's not getting protected as well. But the main issue we see clinically is that failure of the platelet plug.
Which leads right into, how does this actually look to a pet owner?
Yeah.
What signs should they be aware of?
Yeah, what you'd actually notice, the sources say it's a huge range. Some pets might have very mild issues, others can have really severe life-threatening bleeding.
Okay.
But the most common things owners report are bleeding from mucosal surfaces. Those are the wet tissues lining body openings.
Like what specifically?
Things like nosebleeds, the vet term is epistaxis, or bleeding from the gums, maybe when they're chewing a toy, or sometimes for no obvious reason. That's gingival bleeding.
Okay.
Blood in the stool, either bright red, called hematochezia, or dark, terry digested blood, melena. Blood in the urine, hematuria. And for female dogs that aren't spayed, maybe prolonged or excessive bleeding during their heat cycle.
And what about that scenario we started with Bleeding too much after something minor.
Oh, yeah, that's a classic sign. Things that should be routine, like a spay or neuter, dental work, even getting a microchip implanted, or just a nail trim that goes a bit short.
The bleeding just doesn't stop like it should.
Exactly. It's excessive for the procedure,
Mm.
or it stops and starts again. And if the bleeding is severe enough or happens often, the pet can become anemic, low red blood cells.
Is there any type of bleeding that's not typical for VWD? Something that might point towards a different issue like hemophilia?
That's a really key distinction the sources make. Unlike hemophilia, which often causes bleeding into joints, making them swollen and painful, or into body cavities,
Right.
that's generally not what you see with VWD. It's primarily that surface bleeding, the mucosal bleeding, or prolonged bleeding from cuts or surgery sites.
Okay, good to know. And when do these signs usually appear? Is it something puppies are born with?
Well, they're born with the genetic defect, but when the signs show up depends on the type and severity.
The types, right.
For the really severe forms, what we call type 2 and type 3 VWD, owners might notice problems quite early, maybe when the puppy is, say, 3 to 6 months old. Teething can be a trigger. But for type 1, which is the most common and often milder form, the dog might seem totally fine for years. The VWD might only become apparent later in life, maybe after their first surgery, or if they get injured, or even if another illness puts stress on their system.
Okay, let's break down those types then. Type 1, type 2, type 3. What's the difference?
They're classified based on what's wrong with the VWF protein. Is it the amount, or the quality, or both? And usually within a specific breed that's prone to VWD, one type tends to dominate.
Gotcha. So type 1.
Type 1 is definitely the most common one we see, particularly in dogs. The problem here is quantitative. Think quantity, low amount.
Got enough protein.
Right. There's just less VWF circulating than normal. But importantly, the protein that is there usually works okay. It functions normally.
And this leads to?
Typically mild to moderate bleeding signs, maybe easy bruising, prolonged bleeding after surgery, but not usually spontaneous severe bleeds.
And the genetics behind type 1. You mentioned breeds.
The inheritance is a little debated, sometimes called autosomal recessive or incomplete dominant, other times dominant with variable penetrance. The practical upshot is that inheriting the gene defect lowers VWF levels, but how much it affects the dog clinically can vary quite a bit.
Okay. And which breeds are most known for type 1?
Oh, it's a long list. Airedales, Akitas, Bassets, Bernese Mountain Dogs, Dachshunds, Goldens, German Shepherds, Greyhounds, Irish Wolfhounds, poodles, schnauzers, corgis, shelties, Munstans, Manchester Terriers, miniature pinschers, dandy Dinmont Terriers. And you can see sporadic cases in almost any breed or mixed breed, too.
But one breed really stands out in the sources for type 1, right?
Absolutely. The Doberman Pinscher, it's kind of the poster child for type 1 VWD.
Why is that?
The prevalence is just incredibly high in Dobermans. Some studies estimate that up to 70%, 70, of the breed are either carriers or clinically affected.
70%. That's staggering.
It really is. It means if you have a Doberman, the odds are very high that VWD is present in their genes, even if they seem fine.
Okay, well, let's move on to type 2 then.
Right, type 2. This one's less common overall, but it often causes more significant problems. Here, the issue is qualitative. It's about the quality of the protein.
Not the amount.
Well, the VWF level measured by some tests might be low, or it could actually be normal or close to normal. But the problem is that the really important large molecular weight forms of VWF, those super sticky ones we talked about, are missing, or they don't function properly.
So the protein's there, but it's defective. Like having a tool that looks okay but is broken.
That's a great analogy, yes.
Yeah.
The concentration doesn't match the actual function, and this usually leads to moderate to severe bleeding signs.
More severe than type 1, potentially.
Often, yes, which seems counterintuitive if the measured level is higher, but it's because those critical large multimolmers are absent. The genetics for type 2 can be autosomal recessive or dominant, depending on the specific mutation and breed.
And which breeds are linked to type 2?
The main ones the sources highlight are the German wire-haired pointer and the German short-haired pointer.
Okay. And that leaves type 3.
Type 3. This is the least common, thankfully, but it is the most severe form of VWD.
Why so severe?
Because it's a severe quantitative deficiency. These animals have virtually no detectable VWF protein in their plasma. It's essentially completely absent.
There's nothing there.
Pretty much. And as you can imagine, this leads to severe, often spontaneous bleeding episodes. Bleeding from the gums, nosebleeds, prolonged bleeding from minor wounds. It can be life-threatening.
And the inheritance.
Type 3 is typically autosomal recessive. You need to inherit the defective gene from both parents to be affected.
Which breeds are most associated with this severe type 3?
The key breeds listed are Chesapeake Bay Retrievers, Dutch Cougars, Cocker Honges, and Scottish Terriers. Interestingly, Shetland Sheepdogs also pop up here. They can apparently get both type 1 and type 3, which is unusual for a breed.
Wow. Shelties have it tough then.
Yeah.
And, like the others, sporadic type 3 cases can occur too.
Yes, absolutely. In any breed.
The sources also briefly touched on acquired VWD, not inherited.
Ah, yes, that's a good point to bring up. Sometimes other health conditions can mess with VWF levels or function. It's not the dog's genetics, but something else causing the problem.
Like what?
Things like severe hypothyroidism, certain types of cancer, or some immune-mediated diseases have been linked to acquired VWD. The good news there is that if you treat the underlying disease, sometimes the VWF levels can improve.
Interesting. Okay, so that covers the what and the how it looks. Let's pivot to diagnosis. How does a vet actually figure out if VWD is the culprit behind the bleeding?
Well, the diagnostic process usually starts with suspicion, right? Based on the clinical signs we talked about, the type of bleeding, its severity, and importantly, the breed of the dog.
Knowing those breed predispositions is key.
Absolutely. But suspicion isn't enough. You need tests to confirm it. And crucially, you need to rule out other, more common causes of bleeding first.
What's the absolute number one thing they check first?
Platelet count. Always, always check the platelet count. Low platelets, or thrombocytopenia, is by far the most common reason for the kind of bleeding we see with VWD, so you have to rule that out.
And in a typical VWD case, the platelet count would be?
Normal. Completely normal. That's a key piece of the puzzle.
Okay, what else do they rule out?
They'll consider other things like severe liver disease, because the liver makes many clotting factors, or vitamin K deficiency or poisoning, which also affects clotting factors. Certain drugs can interfere with platelet function, and then there are other, much rarer, inherited clotting disorders.
So platelet count is normal. What about those standard clotting time tests vets run, like PT and APTT?
Right, the prothrombin time,
Yeah.
PT, and activated partial thromboplastin time, APTT. These mainly assess the secondary clotting cascade, the factors involved in forming that fibrin clot, because VWD is primarily a problem with the initial platelet plug.
Those tests are usually normal too.
Exactly. PT and APTT are typically normal in most cases of VWD. Now, because VWF carries factor 8 in very severe type 3 cases where there's basically no VWF, the factor 8 level might drop low enough to slightly prolong the APTT. But that's not the common finding, especially in type 1 or 2.
Okay, so normal platelets, normal PTAP, PTT. This points away from common issues and towards that primary platelet problem. How do they test that?
There are screening tests specifically for primary hemostasis. The classic one, though maybe done less now with newer tests, is the buccal mucosal bleeding time, the BMBT.
Buccal mucosa, inside the lip again.
Yep. The vet makes a very small, standardized little cut or prick on the inside of the lip where there are lots of tiny blood vessels, and then carefully times how long it takes for the bleeding to completely stop.
And what's normal?
Normal is pretty quick. For dogs, it's usually less than 4 minutes. For cats, even faster, typically under 2.5 minutes.
So in a dog with VWD,
It's going to be prolonged. How prolonged depends on the type and severity. For milder type 1, maybe it takes 5 to 10 minutes. For the more severe type 2 or type 3, it's often significantly longer, like over 12 minutes. Sometimes it just doesn't really stop on its own.
that seems like a pretty clear indicator. Are there downsides to the BMBT?
Yeah, it does have limitations. It requires skill to do consistently. The results can be affected by things like sedation or blood pressure. And it doesn't tell you why the bleeding time is long. It just says there's a problem with primary hemostasis. Could be VWD, could be something else affecting platelets.
Any other screening tests like that?
There's another point-of-care test called the PFA 100, which also measures platelet function under high shear stress. It's also typically prolonged in VWD, again, more so in types 2 and 3 than type 1. But like the BMBT, it's sensitive but not specific just for VWD.
Okay, so BMBT and PFA 100 can raise a big red flag. What's the next step? The test that actually confirms VWD.
The definitive test, what the sources call the gold standard for quantifying VWF, is the VWF antigen assay, usually written as VWF.AG.
Antigen assay. So that measures the actual amount of the protein.
Exactly. It measures how much VWF protein is physically present in the dog's plasma. The results are usually reported as a percentage relative to a pool of normal dog plasma, which is considered 100%.
What percentage level is considered deficient?
Generally, levels below 50% are considered deficient or borderline. However, and this is important, clinical bleeding problems usually don't become significant until the levels drop quite low, typically below about 25%.
So a dog could have, say, 40% and be a carrier, or have very mild type 1, but maybe not show obvious signs.
Correct. They might only have issues with major surgery. Below 25%, the risk of bleeding definitely increases.
And how do the VWD types look on this VWF.Aggie test?
It helps differentiate them partially. Type 1 dogs will have low levels, usually somewhere in that, say, 10% to 50% range. Type 3 dogs have extremely low or undetectable levels, often less than 5%, sometimes even less than 1%, practically zero.
And type 2, where the amount might be normal.
Yeah. Type 2 is the tricky one for this test because the VWF.Ag measures the amount. A type 2 dog could have low, borderline, or even normal results on the VWF.Ag test alone.
So the VWF.Aggie can't reliably diagnose type 2 on its own.
Correct. Because the problem in type 2 is the function or the structure of the protein, not necessarily just the amount.
So how do you diagnose type 2 then? Or tell it apart from type 1 if the ag level is low?
You need additional tests that assess either how well the VWS works its function or what sizes of the protein are present at structure.
Okay, what kind of functional test?
There's one called the VWF collagen binding assay, or VWF.CBA. Remember how VWF needs to bind to collagen at the injury site? This test measures how well the dog's VWF actually does that.
How does that help differentiate type 1 and 2?
In type 1, you have low amount, low VWF-Ag, but the protein works okay, so the function, VWF.CBA, is usually reduced roughly in proportion to the amount. But in type 2, you might have a decent amount of protein, normal or near normal VWF-Ag, but it doesn't bind collagen well because the big effective multifermers are missing. So the VWF.CBA result will be disproportionately low compared to the VWF.Ag result. That mismatch points strongly to type 2.
Got it. Low function relative to the amount screens type 2. What about looking at the structure, those big pieces you mentioned?
That's done using VWF multimer analysis. This is a specialized lab technique, usually done at referral labs, that basically separates the VWF protein out by size and lets you see the distribution.
Like looking at a lineup of the protein sizes.
Exactly. A normal dog has a full range, from small to medium to those really important large multimormers. The sources confirm that in type 2 VWD, you specifically see that the largest, most functional multimormers are missing or greatly reduced. Seeing that pattern visually confirms type 2.
That makes sense. So type 1 equals low quantity of all sizes. Type 2, okay, quantity maybe, but missing the crucial big ones. Type 3 equals pretty much nothing there.
That's a great summary, yes.
And then there's genetic testing, the DNA tests.
Yes, DNA testing has become a really valuable tool. Specific tests are available for the known mutations causing VWD in certain breeds, like the type 1 mutation in Dobermans, the type 3 mutation in Scotties or Shelties, the type 2 in German short-haired pointers.
What's the big advantage of a DNA test?
The huge advantage is that it tells you the dog's genetic status with certainty, regardless of their age or other factors. Unlike the VWF.Ag test, which can fluctuate a bit with stress, illness, or even vaccination,
Right.
the DNA test result is fixed. It tells you if the dog is genetically clear, has 2 normal copies of the gene, a carrier, 1 normal, 1 mutated copy, or affected, 2 mutated copies. This can be done on puppies, it's not affected by temporary factors, and it's incredibly useful.
Especially for breeding decisions, I imagine.
Absolutely critical for responsible breeding, yes. We can talk more about that with management.
Okay, definitely. So let's say a pet is diagnosed. How do you manage VWD? What are the treatment options, especially if they're actively bleeding or need surgery?
Right. Management really depends on the immediate situation. Is it an emergency bleed right now, or are we planning ahead for something like a spay?
Let's start with an active bleed, say a bad nosebleed or bleeding after an injury.
Okay, for acute active bleeding, the first thing is basic first aid if possible, like applying firm, direct pressure to a wound.
Makes sense.
Vets will also often reach for drugs called antifibrinolytics. Common ones are aminocaproic acid or tranexamic acid. These drugs don't actually provide the missing VWF or make platelets stickier.
What do they do then?
They work on the other side of the clotting process. They help prevent the breakdown of any clots that do manage to form. So they help stabilize the weak clot, making it last longer. They can be really helpful.
Okay, stabilize the clot. But what if the bleeding is severe and that's not enough?
Then the core treatment is replacing the missing von Willebrand factor. And the only way to do that is through transfusion of blood products that contain VWF.
Which blood products work best?
The sources are very clear on this. Cryoprecipitate is the ideal choice
Cryoprecipitate. Why is that the best?
because it's made by thawing fresh frozen plasma in a specific way that concentrates the VWF, factor VIII, and another protein called fibrinogen into a smaller volume. So you get a big dose of the good stuff without giving a huge volume of fluid.
Makes sense. Concentrated VWF. What if cryoprecipitate isn't available? It sounds specialized.
It can be harder to get, yes. If cryo isn't an option, then fresh frozen plasma, or FFP, is the next best choice. It contains VWF too, just not as concentrated.
Okay.
You could also use fresh whole blood, especially if the pet is also anemic and needs red blood cells. Whole blood provides VWF, other factors, platelets, and red cells.
What about just giving packed red blood cells if they're anemic?
That's a key point. Packed red blood cells, PRBCs, will help the anemia, but they contain virtually no plasma and therefore no VWF or other clotting factors. So PRBCs alone won't stop the bleeding in a VWD patient. They only treat the consequence, anemia, not the cause, lack of VWF.
Got it. Cryo is best, FFP second, whole blood if needed, not just PRBCs. Okay, what about preventing bleeding? Say a VWD dog needs a necessary surgery.
Right. Prophylaxis preventing bleeding before it starts is crucial for planned procedures. The main strategy is, again, transfusion.
Giving cryo or FFP beforehand.
Exactly. Giving a dose of cryoprecipitate or FFP usually about 1 to 2 hours before the surgery starts. This temporarily boosts their VWF levels to hopefully get them through the procedure safely.
How long does that boost last?
That's an important consideration. The sources say the half-life of transfused VWF is relatively short. Levels typically drop back towards baseline within about 24 hours after a single dose. So it's a temporary fix for the perioperative period.
Is there anything else besides transfusion that can help prevent surgical bleeding? You mentioned a drug earlier, DDAVP.
Yes, desmopressin acetate, or DDAVP. This is a synthetic hormone that can stimulate the body to release its own stored VWF from the cells lining the blood vessels, the endothelial cells.
So it squeezes out the reserves.
Kind of, yeah. It causes a temporary surge in circulating VWF.
That sounds potentially very useful. Does it work for all types of VWD?
This is the critical limitation the sources emphasize. DDAVP relies on the dog having functional VWF stored away that can be released. Meaning it's primarily effective only in dogs with mild to moderate type 1 VWD. Those dogs have reduced levels, but they do have some normal VWF stored.
And type 2 and 3?
Type 2 dogs often have abnormal protein that isn't stored properly or doesn't function even if released. And type 3 dogs have virtually no VWF to release at all. So DDAVP is generally considered much less effective or completely ineffective for types 2 and 3.
Okay, that's a huge caveat. DDAVP is mainly a type 1 tool.
Exactly. And even in type 1, the response can vary between dogs. So if it's used, it's usually given as an injection about 30 minutes before surgery, but vets should always have transfusion products ready just in case the response isn't adequate. Also, giving repeated doses can deplete those stores, making it less effective over time.
Got it. Transfusion is the reliable backup.
Yeah.
What about those antifibrinolytic drugs? Can they be used preventatively too?
Yes, drugs like tranexamic acid might be given before and after surgery as well to help stabilize any clots that form during the procedure. And of course, meticulous surgical technique by the surgeon is absolutely vital, minimizing tissue trauma, careful ligation of vessels.
Makes sense. Handle with extreme care and post-op.
Close monitoring is essential. Strict cage rest, checking the incision site frequently for any oozing or swelling, maybe monitoring blood counts like PCVTS to check for ongoing blood loss.
Okay, now this seems really important. Are there specific medications that owners of VWD pets need to make sure their vets avoid using?
Yes, absolutely crucial. There's a list of drugs known to interfere with platelet function or coagulation that should be avoided whenever possible in a VWD patient.
Like what?
Big category. NSAIDs, non-steroidal anti-inflammatory drugs. This includes common pain relievers like carprofen, Rimadyl, meloxicam, Medicam, and definitely aspirin. They inhibit platelet function.
Okay, no NSAs if possible. What else?
Certain antibiotics, especially at high doses, like some penicillin derivatives or sulfa drugs, anticoagulants, obviously, like heparin or warfarin, Coumadin. Certain fluid additives like plasma expanders, Hitastarch. Even things like estrogen compounds or some chemotherapy drugs can have effect.
Wow, that's a significant list. Owners really need to be advocates and remind their vets about the VWD status before any medication is prescribed.
Absolutely. Always make sure the vet team is aware.
So, beyond managing acute bleeds or surgery, what does long-term management look like, and how can we prevent this?
Long-term, it's really about awareness and vigilance. Owners need to be constantly watchful for any subtle signs of bleeding, especially after rough play, minor bumps, or even things like chewing hard toys.
And education is key here.
Hugely important. Owners need to understand it's inherited, know the signs, have that list of drugs to avoid memorized or handy, and critically, have an emergency plan.
Emergency plan.
Yeah, knowing where the nearest 24-hour emergency hospital is, confirming they have blood products like cryo or FFP available. For severe cases, some owners even proactively identify potential compatible blood donor dogs in their area. That prep can save precious time in a crisis.
That's smart planning. Okay, let's talk prevention, especially
Yeah.
in those high-risk breeds.
This is where screening and responsible breeding come in. For breeds known to be at risk, doing a preoperative screening test, like the VWF.ag assay, before any elective surgery is often recommended, especially if levels are likely to be in that risky 25% range.
And for breeding.
Yeah.
Should any dog diagnosed with VWD be bred?
The strong recommendation from the sources is no. Dogs that show clinical signs of VWD should not be used for breeding.
And this is where the DNA tests are really powerful.
Exactly. Where a DNA test is available for the specific type and breed, it's the best tool. It allows breeders to identify not just the clinically affected dogs, but also the carriers.
Carriers being dogs that have one copy of the gene but might not show signs.
Correct. They carry the trait and can pass it on. Knowing the status clear, carrier, or affected allows for informed breeding decisions.
What kind of decisions?
Well, the ideal is to breed two genetically clear dogs. That pairing can only produce clear puppies, effectively eliminating the gene from that line.
Okay.
Breeding a clear dog to a carrier dog is sometimes considered acceptable if all the resulting puppies are then tested. Only the clear puppies from that litter should be considered for future breeding. This can help preserve other desirable traits in a line while still selecting away from the disease gene.
What about breeding two carriers?
That's generally strongly discouraged. Breeding a carrier to another carrier statistically results in 25% affected puppies, 50% carrier puppies, and only 25% clear puppies. It perpetuates the problem.
So DNA testing really gives breeders the power to reduce or eliminate VWD over generations.
Precisely. It's a powerful tool for improving breed health.
Is there anything else long-term? I think I recall a mention of hypothyroidism.
Yes, specifically for Dobermans with type 1 VWD, routine screening for hypothyroidism is often recommended. There's some evidence, particularly in cases that might be partly acquired or worsened by thyroid issues, that treating hypothyroidism can sometimes lead to an improvement in VWS levels or function. It's another piece of the management puzzle for that breed.
Interesting connection. Okay, last big question. Prognosis.
Yeah.
What's the long-term outlook for a pet diagnosed with VWD?
It really varies depending on the type. For type 1, the most common form, which is usually mild to moderate, the prognosis is generally quite good. Most type 1 dogs can live a completely normal lifespan with pretty minimal adjustments. They just need careful management around surgery or significant trauma.
That's reassuring for the most common type. What about type 2?
For type 2, the prognosis is usually considered more guarded. The bleeding episodes tend to be more severe than type 1, and remember, they don't respond well, if at all, to DDAVP. They are more likely to require transfusions for procedures or injuries throughout their life.
Okay, more challenging. And type 3, the most severe.
Type 3 carries the poorest, or at best, a guarded prognosis. The risk of severe, spontaneous, potentially life-threatening bleeding is high due to the almost complete lack of VWF. These pets often need aggressive management and may require frequent transfusions.
That sounds very difficult.
It can be, however, the sources do mention that even with type 3, with extremely dedicated owners and good veterinary support, many of these dogs can still be managed and maintained with a decent quality of life in a home setting. It takes a lot of commitment, though.
So even the worst type isn't necessarily an immediate death sentence, but requires intensive care. What are the ultimate risks if things go wrong or aren't managed?
The main causes of severe illness or death are related to blood loss, either profound anemia and shock from ongoing bleeding, or, critically, bleeding into a vital organ system like the central nervous system, brain or spinal cord, or the respiratory tract.
Okay, wow, we've covered a huge amount of ground here.
We really have.
We went from understanding that basic VWF protein defect and its jobs, through how it looks in pets, the different types, and those breed connections, thinking especially about Dobermans, then navigating the whole diagnostic pathway. From ruling things out to the specific ag and functional tests, plus the DNA angle. Then treatment acute bleeds, surgery prep, cryo, DDAVP's limits, drugs to avoid, and finally, long-term management and that crucial role of responsible breeding.
Yeah, it seems complex when you list it all out, but hopefully breaking it down helps.
Yeah.
That core idea, the faulty VWF, means platelets can't stick, right?
Yeah.
That's really the key to understanding why everything else happens.
Absolutely. And having this knowledge is so empowering for you, the listener. It means you can potentially spot those early warning signs. You can talk more effectively with your vet, especially if you have or are considering getting one of those predisposed breeds.
It really highlights how good diagnostics and proactive care can make such a difference.
Definitely. And maybe a final thought to leave people with.
Go for it.
Thinking about how VWD is the most common inherited bleeding disorder in dogs, and we have tools like DNA tests now that allow breeders to identify carriers in affected animals.
Yeah.
It really makes you consider the potential impact, doesn't it? If breeders consistently use this information, the potential to significantly reduce or even eliminate this disease from affected breeds is real.
It's a powerful example of how genetic knowledge, when applied responsibly, can fundamentally improve the health and welfare of future generations of dogs. It's not just about managing the disease in one pet, but preventing suffering on a much larger scale.
A really profound thought to end on. How knowledge and action can change the future for entire breeds.